So this, what I've noticed, is when you've got back pain or knee pain, the ITB gets like tense. And so it tries to compensate for the biomechanical functions of the body that are not working well. So if you release the ITB here, it can help your lower back, it can help your knees. So once again, the 8 cardinal points, bit at the back and up the ITB. And of course, anywhere there's specific pain, directly on the pain. Thanks, mate.
No worries.
So can I have a look? Is there any questions coming in?
Yep. Love my roll-on. I wait during the night, have terrible leg pain. Roll on my magnesium instantly.
So they're really just testimonials coming in more than questions. That's fantastic. We have got a question here. Suffer terribly from fibromyalgia, pain all over, all the time. Using massive amounts of your product is fantastic. Yeah. Look, again, I would not use huge amounts of it. Not that there's a problem, although there would be a problem if you were using oral supplementation and you use too much of it. That can cause a problem. But when you go transdermally, directly through the skin, then you bypass your digestive system and avoid a lot of those problems. Now this lady here says she's using 250 mils, one of these, every 2 months. That's too much. That's too much. So she's slathering it on all over her body. Now she says she's putting it in the on the pulse points. Yeah, it's good to do that, but if you've got specific pain points, I would stop putting it all over. I would, even though it feels like there's pain all over, there's normally what's called a nerve plexus that's holding on. So if you can explore and find out where the pain is at its most intense in the joint, and just a little bit. Now those of you who know anything about either yoga or acupressure or acupuncture, this is the best way to go. So for example, if you have a pain in the arm up here, people are putting it on the arm, the pain will go away. But if you follow what's called the fascial train from the pain through the shoulder, it'll normally go into the cervical vertebra in the back of the neck. So if you actually take it down there and then follow the tendon down into, and just a little bit, just that much, up the tendon into the shoulder, that will make a massive difference. Yes, rubbing it just on the pain will cause the pain to go away, and it will come back a bit later, and eventually it will go away. But if you explore and find out exactly what works for you, particularly following those trains, and I'll go a bit further into that next week if you'd like, same time next week. So if you have any more questions, write in on our Facebook page, or just tune in at the same time, or I might change the time. I might make it, do you think later would be better? I think later would be better. We'll let you know on Facebook. And are there anything else, any urgent stuff happening? So I'm just going to leave it at knees and fibromyalgia today. Sleep. For fibro, sleep is and also for perimenopause, sleep is the most important thing. And a lot of people are putting it on the bottom of their foot. So I would recommend that you put it on the top of the foot, just a little bit, and sort of on there, not with your shoe on, obviously, and rub it in. And if you're having lower back problems, in the Achilles tendon as well. Now my wife thinks for sleep you should put it in the lower back and a bit down the back of the legs, down your sciatic nerve as well. But experiment, find out what works best for you, and if you find out anything unusual, and lots of people do, if you find out anything unusual, could you let us know so we'll tell everyone else. That's all from me, from Lee today, and from Trent. thank you very much for your time and your company, and I'll let you know on Facebook when we're going to be back again, probably next Friday. Thank you very much. Bye-bye.